Hi guys, welcome back to my channel, Life of a Caribbean Nurse. It is your Nurse Ray. Guys, today I want to give you guys some tips on taking care of the elderly, right? Okay, the first tip I'm going to give you guys, if the elderly individual that you're associated with is a family member or maybe just an elderly individual that was good to you in the past, they don't live with you. First thing first, start by visiting them. Visit the old people then, go and look for them. It's not good enough just to tell the children about all the good that Miss Maisie did do or Mr. John did do for you, and you are not doing anything for them. You're not looking for them. You are not taking care of them. It's not good enough just to speak of their kindness, and you are not lending a kind hand to them. For those individuals that have spouse that have the tendency to tell you, say, look here, on parents and can't come, they call them rank and they nasty, and then this and then that, and you allow them to influence the care that you give to your elderly relatives, may I beg you to stop it. May I beg you to stop it. These elderly individuals were once young. I remember so many of them, I did them take care of Uno. And if it was not for them and the care that they gave to you guys would not have been here today. So they take care of them. Go and look for them. Don't only speak of the kindness that they have done to you. Go visit them. Uno foot no broke. Alright, at COVID time now, you can't visit right now. Call them. Call them. I Miss Maisie, alright? As Suzette, I not lie, me long to see you. I can't come look for you because of COVID time, but guess what? I go send 2 bread come give you. Where's you eat bread? I eat cream crackers? Alright, I go send 2 cream crackers come give you. Right? Find out if Maisie is able to manage by herself. Get somebody there to assess the home for Maisie. When the home is assessed, if you realize that based on the assessment, Maisie might be needing help and might be needing a helper. When getting a helper rather for Maisie, ensure that the helper is not only cheap, but the helper is competent. I understand that cheapness goes far away for many of us, but look here, get somebody that is competent to take care of Miss Maisie. Not everybody is kind, understanding, and patient towards elderly individual. And remember that when they are getting old and older, they become more and more like a child, like a baby. So patience goes a far way with these elderly individuals, right? So guys, go and visit them. Go and look for them, right? It look very bad when these people can tell us that their daughter and son are soldier, police, nurse, lawyers, and some of them end up at hospital and cannot come out because there's no one there to collect them. And some of them they are the yard, and when you go look for them, their ear dirty and have lice or claw and night because nobody even want to go bathe them. Listen, stop it. You guys need to stop it. Go and take care of your elderly. So that's the first tip. Visit them, assess them, and get the necessary help that they might need to take care of them. That's just tip number 1. Elderly and their medication. So a lot of ailments that the elders did not have when they were younger, you might find that they have it now in their old age. Hypertension, high blood pressure, diabetes, blood sugar, glaucoma. They nasty good out of their eye, heart condition. They need medication to help their heart beat better, to help the functioning of them heart. Medication for their kidney because the kidney not work as good as before. So therefore now to get medication to help with the functioning of the kidney, right? And all different medication. So you might go to mommy house, you might go to grandma house, you might go to your elderly friend house, as they have a barrage of medication, no one look back when they put on. I would suggest that you get a pillbox organizer for them. A pillbox organizer basically is a box, plastic box, compartmentalized with like Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, the days of the week on it, and different time on it. So if there are medications once per day, you put it in once per day. So one of that medication per day, BD, that means 2 times per day. And make sure it's organized accordingly. If you have difficulty organizing the medication in this pillbox organizer, what you could do when you go to the pharmacy and purchase one of these, you can ask the pharmacist on how to organize the medication in it. And I'm very sure they'll be happy to show you how to do the same, right? So get them a pillbox organizer because you don't want to risk the possibility of this elderly over-medicating themselves or missing their medication that is very important to them, right? So get a pillbox organizer for them. As well as, guys, so it's not just good enough to say, alright, mommy have our medication in the yard and everything. But also, different from having these medication for them, ensure that you organize doctor visit for them. Make sure they get their regular doctor visit as to see how the blood pressure is doing. Kind of once I medicate them straight to the blood pressure drop, but because they need a check point, they never know it, I give them blood pressure medication every day. So you're going to ensure that you make them visit the doctor, them practitioner very often, as to follow up with their care to see how the sugar is doing now, how the blood pressure is doing, how the higher command, how the heart of function now, as to see if there needs to be any reduction in these medication or any increase in these medication. The doctors will let you know about that. Alright, so ensuring that all the medications are present is important, but it's equally as important as ensuring that they follow up with their doctors as to see how they are now functioning based on the medication that they are now taking. Alright, guys? Okay, guys, tip number 3. Alright, keeping the elders active mentally and physically. Alright, we're going to speak about the mental aspect first. You know, many of these elderly individuals have lost their spouse, their siblings, have lost a lot of individuals throughout their life. They might start feeling lonely. So family members being around them, you know, talking to them, playing game with them, being very socially active with them goes a far way. Sometimes if we don't do these things, we might find the elders start wandering off, you know, going places, seeking companionship, you know, and seeking relationship. So we have to ensure that we keep them active like that. You understand? It helps with keeping their memories together also. So keep them mentally active. Be around them, talk to them, show them love, be involved with them. Physical activities now. We are aware that some individuals may not be able to walk. At least ensure to turn them 2 hourly, 4 hourly accordingly. Right? For those that are bedridden. Get them like egg crate mattress. Mattresses that are a lot more comfortable. You place egg crate mattress over their beds. Right? So it's softer and it keeps their skin intact. Right? Because when they're old, their skin get very soft. Circulation is not as quick and fast as is for us young people. So they might break down easy and they're harder to heal. Right? It takes a lot more time for their wounds to heal than ours. So ensure you turn them very often if they're bedridden. And for those individuals that are not bedridden, you take short distance walk with them, enable better circulation in the body. You walk with them, do a little brisk walking, keep them active. So keeping elders active is very, very, very important, guys. Tip number 4, guys, taking care of yourself. I know sometimes it can be a bit stressful, physically, mentally, emotionally, every kind of way, taking care of elderly, especially when you're not getting as much help from other family members. Right? So what I would suggest is that you ensure that you're in optimum health. Because if you don't take care of yourself and if you're not in a great state of mind, you'll be unable to take care of anybody else, right? So guys, just do the best that you can do for yourself while doing the best that you can do for your elderly. I hope you guys enjoyed this video. Remember to like, share, comment, and subscribe, and tell a friend about my channel. Have a blessed day. Thank you.